There's another thing out there that's called hybrid exosomes. The term which is used by one vendor, which is also one of the market leaders, they used to sell bone marrow-derived exosomes, and then they figured out that umbilical cord-derived exosomes are actually much better as a source. And they came up with this genius marketing idea to just mix them and claim those are the best of both worlds, the best of bone marrow-derived exosomes and best of umbilical cord exosomes. There are two problems. One is scientific. The scientific problem is that it's nonsense. If you have a functional and potent perinatal tissue-derived exosomes, you don't need anything else. Bone marrow-derived exosomes are far inferior, and they are not necessary to actually soup up or improve your exosome product. Secondly, even the term hybrid exosomes is not correct, because hybrid exosomes comes from the idea that you fuse a biological exosome and a synthetic one that is filled with, say compounds or drugs, and you fuse them to actually make them better as a vehicle for your drug delivery. So the term is used incorrectly, and it's really unnecessary and not a good idea. And just on the side, it's an American company, and in America, it's actually unlawful to mix two biologics from two different donors. They keep doing that because the FDA has not come after them, but eventually the FDA will notice, and then they will get shut down and will no longer be able to actually sell that product to begin with. Interesting thing. The same company actually recently came up with, they claim to have invented it, synthetic exosomes. They are usually talked as a technical term. This vendor is calling them, they even claim that they have invented it, which is absolutely incorrect. Niosomes have been around for a long time, and again, they are used as a vehicle for the delivery of some substances, small molecules, compounds, drugs, and they would be interesting for the pharma industry. So if they want to deliver a certain drug or compound, they can create those synthetic exosomes and fill them with this and use it to deliver their compounds. A problem with it is that they have shown to have some side effects because they are synthetic, they are artificial, and the body is not always accepting these kinds of things. But coming down to the point, synthetic exosomes or niosomes are artificial, and they're empty. They're just empty bubbles, and then you can put in whatever you want. And this one company, they put in 10 select growth factors because they're actually by default a growth factor company. So there's nothing wrong with the growth factors. These growth factors are relevant and interesting, and they have some benefits. However, a biological exosome features hundreds of growth factors, and in addition to that, also lipids and metabolites and very important RNAs. So RNAs are considered the blueprint and instructions for the building blocks, those functional proteins, to actually regenerate and repair a cell. So if you just create an artificial exosome, niosome or biosome, and put some growth factors in, that might have some temporary effect, but it's a far cry from biological exosome. And their claim that it is an analog which operates at the same level is just incorrect, wildly incorrect, and misleading customers.